Mahafade and good morning and welcome to the Office of the Governor of Guam. We are delighted to have you here with us to proclaim, we're a little early, November 2024 as Diabetes Month. Before we begin, I of course want to recognize the presence of our Governor, the Honorable Lourdes A. Leon Guerrero. The Honorable Joshua Tenorio, our Lieutenant Governor of Guam. From the 37th Guam Legislature, Speaker Therese Turlahi. Also joining us is Senator Will Parkinson. From the Leon Guerrero Tenorio Administration, our cabinet members, Therese Ariola, Director for the Department of Public Health and Social Services, as well as her deputies, Peter John Camacho and Mr. Terry Uggan. Also want to acknowledge Catherine Ankow, the Chief Public Health Officer. From the Guam Diabetes Association, I want to acknowledge our officers and our Executive Director, Winnie Butler, Hafaday. Mr. Scott Duenas, President and former Mayor, of course. Let's give him a round of applause. Mrs. Clara Peterson, Vice President. Keep the applause coming. Glennis Almonte, Registered Nurse and Secretary. Lisa Kenworth, our Treasurer. Mr. Patrick Lucius, Board Member. And Attorney Robert Cruz, our advisor in the back. Also want to acknowledge Stella Gahan, our board member. Also joining us at the table, we have Rose Greeno, registered nurse, executive director for the Guam Nurses Association. We're seeing a lot of familiar faces from last week's Breast Cancer Awareness Month, so this is great. Aggie White, registered nurse, president for the Guam Diabetes Foundation of Guam. Dr. Melissa Young, director of Providers Relations at Total Guam Foundation. Dr. Zenny Assumption Mays, Chief Financial Officer, Total Guam Foundation. Maria Cummings, First Vice President of Tiffany Lions Club. The applause coming. Amber Leonin, Executive Director for Tiffany Lions Club. Joshua Dunn, Wellness Program Administrator for Calvo Select Care. Also, some of our partners here today, I want to recognize Delbert Calvo from Tatua Hula Fitness, keeping us in shape. Yes. Tish Tidegui from Vera, who's also an advocate for fitness and wellness programs. Let's give a round of applause. From the Department of Public Health and Social Services, our programs and other organizations, I want to recognize our Non-Communicable Disease Prevention and Control Program. That's diabetes and tobacco. I think of all the agencies in GovGuam, Department of Public Health and Social Services has the very long titles. Behavioral Risk Factor Surveillance System Program. Let's give them a round of applause. The Guam Breast and Cervical Cancer Early Detection Program also here. The Guam Comprehensive Cancer Program. And the Office of Minority Health. This is also awesome. Also want to recognize the Guam Diabetes Control Coalition. The University of Guam T2. The University of Guam Health Disparities. And SCA Clinic joining us. Hafaday and welcome to the Office of the Governor. So that was a lot of partners, and that just shows how strong our community feels about this particular issue. And without further ado, I want to recognize and give her the microphone now. Therese Ariola, Director for the Department of Public Health and Social Services. Therese, you have the floor.
Thank you, Crystal, and thank you, Governor, Lieutenant Governor, Speaker Terlahi, Senator Parkinson, all our providers, our associations, all our stakeholders that really, in the end, really want to just champion and stop diabetes in our island. I'm not going to thank you, everyone, for showing up. I think the room is very full, and that's just a sentiment of how much diabetes has touched our island and how much we know that we need to do much more to curb this disease that is just affecting all our families. One of the things, so first of all, thank you, and thank you for all that you do. I know we have a conference coming up in November, and there's just so many programs, outreaches that's being planned, and stay tuned because it's going to seem overwhelming, but that just means that we have so much to do in our community. One of the things I just want to say real quickly is I had the privilege of joining the governor and several of our cabinet members to meet with Region 9 HHS last week, and one of the things that, of course, was brought up was diabetes and how prevalent it is on Guam. And one thing that is very concerning for me and should be concerning for everybody is the idea that almost every village in our island has a renal center or a dialysis center. And so as much as I love that partnership, I don't want any more for our island. And so it is very clear that we have so much to do. One of the things that we talked about is using public health and our prevention efforts in changing behavior in our eating habits. And so down the road, you will hear more about things called food is medicine, as well as double bugs. We're looking at working with SNAP to ensure that if you purchase healthy foods, vegetables, fruits, you're going to get double your SNAP dollars for our SNAP recipients. So that's all in the works and so much more. And so I just want to say thank you. The horizon for diabetes on Guam is going down as far as I'm concerned with all our efforts. And so thank you very much to all our providers who take care of our patients. Thank you so much. But I'm a proponent of prevention. So let's not get them to the point of, what is it? What is the shot that they give? Insulin. Let's just get to the point where we just are healthy and we don't need to see any more of this disease in our island. Too many of our families are affected, and we just want to stop it right here. So thank you very much for all your efforts.
Thank you, Director Ariola. Before I proceed to our governor and our lieutenant governor, I fail to recognize a good friend of mine at the table, Gina Rojas, Executive Director of the Guam Diabetes Foundation, the Diabetes Foundation of Guam. Thank you so much, Gina, for joining us. And now I want to give the floor to the Honorable Lourdes A. Leon Guerrero, Governor of Guam.
Thank you very much, Crystal. Welcome. What a great way to end the week, huh? Because I know that weekends are also very important in terms of all the work that we do. But I just want to especially give a lot of recognition to the Department of Public Health and Social Service, their non-communicable disease prevention unit, because like Therese said, prevention is key. And we all know about diabetes, how it's very prevalent in Guam. We all know that a lot of it could be prevented by better lifestyle, health lifestyle. I love the hula partner here, because exercise is very crucial also and essential to continue having a healthy lifestyle. I over the many years that I've been here, I have seen the evolution of the Guam Diabetes Association. And the Guam Diabetes Association is a foundation, I think, in the community. And I know, Winnie, that your husband, Carl, was very, very active, influential, and a great driver from the very beginning. And as we move along and we recognize various good community members and nonprofit organizations and even our government services in this whole community of fighting diabetes, let us also be very grateful for the advances and the progress that we have made. We see more people exercising, right? I mean, we went from fiestas of no vegetables at all to now there's salads, there's fruits. I mean, sometimes we feel that our hard work isn't really making an impact, but it is. And prevention is one of the most difficult outcome to achieve because it's not an immediate gratification. It takes a long time for us to see the results of health education, community education, prevention, and even treatment. And I know that diabetes research has come forward with some really more advanced and better medicines to help us. But we shouldn't really, like Therese say, we should work very hard to not get to where we have to take diabetic medications. And I also want to encourage you to also focus on prenatal care, right? Focus on families and parents to teach their children about healthy food because it starts there. We need to also focus in our kindergarten, nursery, elementary schools, middle school, high school, on to the university, and we need to continue putting forth the great pressure of educating our people in healthy lifestyle. I know it's a hard thing to do, but it works, and the return on our prevention investment in education, we are now seeing more of it as an impact. So thank you, everybody, all the nonprofit organizations, all of the agencies that provide the prevention and the treatment, and our whole community. Thank you for all your effort, and know that our administration is very supportive to improving the healthcare and quality of our healthcare here in our islands. So thank you again, and we're there with you in support and resources that you need. Mrs. Masi.
Mrs. Masi, Governor. And now turning the floor to the Honorable Joshua Tenor, Lieutenant Governor of Guam.
I just wanted to quickly thank all of you for your individual and collective effort. When you have a call to action and you have so many people that are part of it, the reach into the community is so much more effective. So on behalf, of course, of the people of Guam, I just want to recognize and appreciate the honor and the opportunity that we have today to spread the word to the public about diabetes and all the things that can be done to avoid, prevent, and treat. Thank you very much.
Thank you, LT. And now for the reading and the signing of the proclamation. Our reader today is Scott Dueñas, former mayor and president of the Guam Diabetes Association.
Good morning. And I'm going to try to read this. I've given up reading instructions for anything that we use. So let me labor to read the proclamation. And okay, a proclamation of the governors proclaiming November 2024 as Diabetes Month. Whereas every November, our island observes Diabetes Awareness Month, along with the rest of the nation, to educate our community about diabetes, including type 1, type 2, gestational diabetes, and pre-diabetes. Promotion, prevention to maintaining a healthier lifestyle and support of struggling with their chronic conditions. Whereas diabetes can lead to heart disease, kidney disease, vision loss, and other serious health complications, adults diagnosed with diabetes are 2 to 4 times more likely than people without diabetes to succumb to heart disease and experience a stroke. Whereas the risk factor for poor diet, lack of physical activity, and lifestyle behaviors contribute to other comorbidity that leads to the complication of diabetes. Our island has seen a significant rise in the number of adults diagnosed with diabetes, and diabetes is the primary contributor to 2 of 3 leading causes of death on the island, including heart disease and stroke. Whereas approximately half of the people who succumb to COVID-19 in Guam identifies diabetes as a comorbidity. According to the Centers of Diabetes Prevention and Control Behavioral Risk Factor Surveillance System, adult survey, the prevalent rate of diabetes in Guam surged from 11.7% in 2019 to 21.6% in 2022. In 2023, the diabetes prevalence rate decreased to 16.4, whereas the Guam Diabetes Association the Department of Public Health and Social Services, the Guam Diabetes Control Coalition, the Diabetes Foundation of Guam, the Non-Communicable Disease Consortium, and many other public and private organizations are committed to continuing their substantial effort to support the struggle with diabetes through diabetes self-management, education, and support. Whereas on November 10, 2024, the 25th Annual Guam Diabetes Association Conference will be held to raise awareness of this disease. Whereas managing blood glucose, blood pressure, and cholesterol level along with taking medication daily, having regular doctor's checkup, diabetes self-management education and support, and maintaining healthy lifestyle through physical activities. Hydration and eating nutritional meals are a few of the many ways we can prevent diabetes. And whereas in our island recognized Diabetes Awareness Month, we stand with those diagnosed with diabetes and pre-diabetes. We recognize the many organizations and agencies across Guam dedicated to combating this diabetes and providing necessary education and support to improve the lives of those struggling with it. We recognize family support as positively related to improved self-management, which can lead to better health outcome.
Now, therefore, I, Lourdes A. Leon Guerrero, Imagahagan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 2024 as Diabetes Month.
In witness whereof, I, Joshua F. Tenorio Segundo Magatlahin Guahan, Lieutenant Governor of Guam, hereby together with the Magahaga, cause the Great Seal of Guam to be affixed in the capital city of Lagatnya on this 18th day of October in the year of our Lord, Anno Domini 2024, and Viva Guam Diabetes Awareness Month.
Yeah.
Thank you so much, Governor, Lieutenant Governor, and of course, Mayor Duenas for the reading of the proclamation. That concludes today's event, but I do want to make sure we take a group photo before we leave. I want to defer to my photographer. Do you want us to come here?